Ever wondered if that unusual vaginal discharge is just part of being a woman or something more serious? Well, it's a question that crosses the minds of many, and the answer is it depends. Some forms of discharge are completely normal and a part of your body's natural processes, but other times it might be a sign of something more concerning. You see, vaginal discharge can be a bit of a chameleon, changing its color and consistency throughout your menstrual cycle. It can range from clear and watery to thicker and milky white. And guess what? That's perfectly normal. However, if it starts to look like cottage cheese or takes on a green, yellow, or gray hue, it might be time to ring the alarm bells. So it's clear that not all vaginal discharge is created equal. But what are the differences? Well, stay tuned as we delve deeper into this topic in our next scene. The color of your vaginal discharge can give you a lot of information about your health. Now let's unravel the meaning behind these colors. You see, the hues of vaginal discharge are like a color palette of your health. A clear or white discharge is perfectly normal and is a sign that your vagina is cleaning itself. It's also natural for the color to shift towards a light gray, particularly around your menstrual cycle. However, when the color of the discharge turns a shade of brown, it's usually an indication of old menstrual blood leaving your body. While it may seem alarming, it's typically nothing to worry about unless it occurs frequently outside of your period. But here's where we need to pay close attention. If you notice your discharge turning shades of blue, green, or yellow, consider that a red flag. These unusual colors often signify a potential infection like trichomoniasis or bacterial vaginosis. Now let's talk consistency. If it's thick and curd-like, it could suggest an overgrowth of yeast, a common culprit for a vaginal yeast infection. And if it's accompanied by an unpleasant odor, it could be a sign of bacterial vaginosis, which requires medical attention and possibly antibiotics. So, unusual colors or consistencies are definitely a red flag, but what should you do if you notice them? If you've noticed unusual vaginal discharge, it's crucial not to ignore it. This isn't something to brush off, as it could be a sign of an underlying health issue. The colors of discharge can vary greatly, and while some are perfectly normal, others can be red flags. If the discharge is blue, green, or yellow, it's time to consult a healthcare professional. These colors might indicate an infection that needs medical attention. Similarly, a continuous white discharge accompanied by itching could signal a vaginal infection. It's also important to note the consistency and smell. If there's a foul smell or unusual consistency, it could be a sign of bacterial vaginosis. This condition requires medical attention and possibly antibiotics to clear up. You might feel uneasy or even embarrassed about discussing these issues, but remember, healthcare professionals are there to help you. They've seen and heard it all before, and their primary concern is your health and well-being. If you've been experiencing any of these symptoms for a while, it's crucial to seek help. There's no need to suffer in silence. Consult a healthcare professional to find solutions that can alleviate discomfort and ensure your health. Remember, your health is in your hands. Don't hesitate to seek help if you notice anything unusual. Your well-being is worth it.